Dear friends, let us discuss about the image-based anatomy questions in the lower limb. This is in continuation of the image-based anatomy question 2 of the lower limb, where we have learned about the upper end of femur, the various bony prominences and the muscles attached to it. So, in this session, we will see the posterior aspect of the femur. Now, let us look at the image. This is the posterior surface of the upper end of the femur, and you could identify it that it is of the right side based on the position of the femoral head, and then you are seeing the posterior aspect. How to identify the components of the posterior aspect we will learn, and you could identify the neck, which you have already learned from the anterior aspect, and you have seen the greater trochanter and lesser trochanter. So now we will see the image based questions. So the side is right side and the posterior surface of upper end of femur, which you are seeing. Then you could identify the head. There is a small depression in the center of the head, and which is called the fovea, and to which a ligament is attached. What is that ligament and what is its importance? And it is the ligament of head of femur, or ligamentum teres femoris. It is also called. It's a rounded ligament, and then it keeps the head of the femur in position. And the peculiarity is it is intracapsular and extrasynovial, and an artery accompanies the ligament of head of femur, and that artery is a branch of the obturator artery. So that is about the ligament of head of femur. Then you have to identify the structure here and name the muscle attached to it and its nerve supply. So this rough elevated area is the gluteal tuberosity. Gluteal tuberosity, and the muscle that is attached is the gluteus maximus muscle, because you have learnt about the gluteus medius and minimus muscles getting attached to the greater trochanter on the anterior surface we have learnt. Then there is what about its nerve supply? What is the nerve that supplies the gluteus maximus? So the gluteus maximus is supplied by the inferior gluteal nerve. So inferior gluteal nerve supplies the gluteus maximus. Then we will see the next question. So what is this area which is marked here? So this is the intertrochanteric crest. So intertrochanteric line is seen on the anterior aspect and intertrochanteric crest on the posterior aspect. So that's also an identification point for the side of the bone. Then what is attached here? So there will be an elevation here which is known as the quadrate tubercle, to which the muscle quadratus femoris is attached. Don't get confused with the quadriceps femoris. Here the attachment is the quadratus femoris muscle. So you have learned about the intertrochanteric crest in this surface, and you have already learned about the intertrochanteric line. Then you have identified the lesser trochanter. And what is the muscle that is attached to it and what is its nerve supply? So So the muscle that is attached to it is the iliacus and psoas. We combine them and call it as the iliopsoas. And what is the nerve supply of that muscle? The iliacus, it is supplied by the femoral nerve, whereas the psoas, major muscle, which will be supplied by the lumbar nerves, the ventral rami of L1 to L3 nerves. They will be supplying the muscle. So, we learned about the lesser trochanter, the muscle attached, and the nerve supply of those muscles. Then the next question is on the greater trochanter. So, what are the muscles attached to it? I have already learned. What are they? Try to recollect. The gluteus medius, the gluteus minimus, the piriformis, the obturator internus, the two gemellae, and obturator externus. These are the muscles attached to it which we have learned. So what is their nerve supply? We have learned that the gluteus maximus, which is getting attached here in the gluteal tuberosity, is supplied by inferior gluteal nerve. So these two muscles, gluteus medius and minimus, will be supplied by superior gluteal nerve. So remember the nerve supply of these three gluteal muscles and see the change in the innervation for the gluteus maximus by the inferior gluteal nerve, which you may get as an MCQ in the examination. So coming to the piriformis muscle, which will be attached nearer to this apex of the greater trochanter. It is supplied by anterior rami of S1 and S2 nerves. So that is about the piriformis muscle. Then what are the other muscles that are remaining here? The obturator internus and the two gemellae, which will be attached on the medial surface. So what are the muscles that will be attached here? They are the obturator internus and the two gemellae, superior gemellus and inferior gemellus. And there is the trochanteric fossa where the obturator externus is attached. So what is the nerve supply of these muscles? The obturator internus and superior gemellus are supplied by the root to obturator internus, whereas the inferior gemellus along with quadratus femoris, which is attached to the quadrate tubercle, they are supplied by the nerve to quadratus femoris. So now we have understood about the various muscles that are attached to the greater trochanter. So what is left out is the obturator externus. So the obturator externus muscle will be supplied by the obturator nerve. The posterior division of the obturator nerve will be supplying it. Then what is the next question? If you have understood about the greater trochanter, the various muscles and their nerve supply, then identify the structure. So this is seen only in this bone you are seeing, and this is called the third trochanter. Third trochanter. There is the greater trochanter, lesser trochanter, and third trochanter, and which is seen in 15 to 50% of bones. And then what is its importance? It is seen in the lower animals and it is seen more prominently in the Neanderthal man. So it has got an evolutionary significance and it gives attachment to the superficial fibers of the gluteal muscles. That is the importance of this third trochanter. Then coming to this line you are seeing. So there is a line extending downwards from the lesser trochanter downwards. And what is that line? And that is called the pectineal line. What is attached to that line? There is a muscle called pectineus which is attached to this line, and then what is its nerve supply. So the pectineus muscle will be supplied by the anterior division of the obturator nerve. So you could recollect all the bony points on the posterior surface of upper end of femur, the various muscles that are attached to it, and their nerve supply you have recollected, and you have learnt about several small muscles here. They are known as the small lateral rotators of hip or the external rotators of hip. So what are those external rotators? They are the piriformis, the two gemellae, gemellus superior and the gemellus inferior, the two obturator muscles, that is the obturator internus and externus, and quadratus femoris. Okay, all around this area. So they are the small lateral rotators of hip or external rotators. So there are internal rotators also. They are the gluteus medius, the gluteus minimus, and in addition there is the tensor fascia latae. So now you have understood about the upper end of femur. If it is given as a question, you will be in a position to answer it, and if MCQs are asked in this area, you are in a position to answer. MCQ. So the first one is, all the following muscles are supplied by superior gluteal nerve except, is it gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia latae. So there are two gluteal nerves, one is the superior and the other is inferior gluteal nerve. So all are supplied by superior gluteal nerve except, so that except is the gluteus maximus muscle. Then coming to the next MCQ, obturator nerve supplies which of the following muscles? I have named only few muscles in relation with the upper end of femur. So what are those muscles? Try to recollect. Are they gemellae, the obturator internus, obturator externus, and quadratus femoris? Which one? So it is the obturator externus muscle, which is supplied by posterior division of obturator nerve. So that is answer is C. Now let us see the next one. All the following muscles are small lateral rotators of hip except, we have mentioned 6 muscles. So try to recollect them. Is it piriformis, obturators, gemellae, pectineus? Which one? It is the pectineus muscle. It is the right answer. Hope this is useful for you for understanding the upper end of femur and the related MCQs.